Good evening. You're watching Kamna TV, not just another channel. This is The Verdict, and welcome. Like many other developing countries, Zambia's healthcare system remains challenged. The healthcare system is decentralized, meaning it is broken up into three different levels: hospitals, health centers, and health posts. Hospitals are separated into primary district, secondary provincial, and tertiary central. Zambia offers universal health care for its citizens. The Patriotic Front have so far made strides to help alleviate some of the challenges faced. How well they have performed is our discussion today. Helping me dissect on this topic, which is Zambia's health sector under the Patriotic Front, is the United Party for National Development Health Committee member, Mr. Jerome KANYIKA. Good evening and welcome to The Verdict.
Good evening, and good evening, the viewers.
The topic today is quite broad. We are discussing the healthcare sector in Zambia. How well or how bad the Patriotic Front have performed. Remember, the number that you are calling us on is scrolling down your screen, and feel free to participate in the program. First things first, on a scale of 1 to 10, how would you rate the Patriotic Front, generally speaking?
Okay, I think I would give them 3 out of 10.
Why is that so?
When we check the health sector, in terms of service provision, which I'll talk more, I think the Patriotic Front has failed to provide the health service to the Zambian people the way the Zambian people are supposed to receive the health service, despite a lot of cooperating partners and donors pushing in a lot of cash in the health ministry or in the health provision. We have not seen the results that reflects the amount of money that the donors or other cooperating partners have pushed in.
Speaking of finances, I was about to ask you the question whether you feel that the health sector is fully funded or is being funded the way that you feel that it should be funded.
Currently, I can say the health sector is very much underfunded. When you check very well, in 2000, if I'm not mistaken, there was the Abuja declaration in terms of funding to the health sector, and the declaration that came in there was to fund the health sector by 15% of the total national budget. But when you check very well with the Patriotic Front, they fund the health sector by, like, for 2021 budget, it's about 8.7%, if I'm not mistaken, or 9%. So when you check very well, you discover that, yes, there is serious underfunding to the health sector, and far from reaching the Abuja declaration, which was declared in 2000, somewhere there, or 2010.
Is it because there's no money in the government coffers?
Not really. It's due to lack of priorities. That's the way they are supposed to. That's what I can say. If we put our priorities right and we put the health sector, our service provision to the members of the public as a priority, we can be able to fund by 15% of the national budget.
As the UPND Alliance, how do you intend of sorting out this problem, this challenge of funding in the healthcare system?
You see, first thing first, we are going to make sure that we follow what the Abuja declaration of 2010, if I'm not mistaken, I hope I'm not mixing the years, of 15% funding of the total national health national budget. We are going to give 15% to the Ministry of Health, because as you know very well, the health sector does not discriminate. It caters all angles: the rich, the poor, people with different special needs. They are also covered in the health sector. So no wonder the funding to health sector should always be according to the recommended funding, so that at least you provide adequate health service to everyone and to every citizen without any discriminatory.
The Patriotic Front has on a number of times boasted of the fact that they have built more rural health posts in this country than any other successive government, including turning hospitals like the Levi Mwanawasa, upgrading them into teaching hospitals, and also improving clinics into level 1 hospitals.
You see, we need to understand very well what the Patriotic Front have done to the health sector. They have just gone to rechange the names of the already existing infrastructure. They go to Kitwe Central Hospital, change the name to Kitwe Teaching Hospital, but the buildings and the service remains the same. They go to UTH, they go to Ndora Central Hospital, they change it to Ndora Teaching Hospital, the services still stands the same. The funding still stands the same. The service, the personnel that are in those hospitals still stands the same. They go to Chawama Clinic and change the Chawama Clinic into Chawama Level 1 Hospital. It's like just changing the names. It's like what I like saying is you change the name of a bus conductor to a bus manager. Have you changed the laws of that person? It's still the bus conductor. So that's the same situation the Patriotic Front have done. Have they improved the services? No. We still have a problem with the equipment. We don't have equipment in our hospitals. We still have problems with shortages of health workers. We still have problem with the shortages of drugs. We still have problem with shortages of specialized medical personnel. We still have shortages of laboratory reagents. We still have shortages of even scanning materials. All these things are still problems that the people of Zambia are facing. Has the name changed that? No. The service is still poor. No wonder I said I'll give them 3 out of 10. Because the service is still poor and Zambian people are interested in receiving the service than in changing the names. Let it be, even call it whatever you call it, a shanty clinic or whatever thing, but provided every Zambian, as they go to that facility, they are able to find a doctor there, they are able to be scanned, they are able to get the medications, they are able to do all the laboratory services there, they are able to do any scans. The Zambian people are okay with that. They are not okay with changing the names. What has changing of names helped you? Has this changed the way you are being serviced at the health facility? The answer is no.
They might argue to say, but for services to be able to be provided, then the first thing that needs to be done is the infrastructure, which they say they have built enough infrastructure. If, for instance, I'm sure you're a Lusaka resident, you go to level 1 hospital.
I'm a Copper Belt
Okay, even when you go to the Copper Belt,
Lusaka,
but
yes.
you know Lusaka.
Yes.
For instance, a few kilometers from here, you
Yes.
go to Chilenje level 1 hospital.
Yes.
The infrastructure there, or even in Matero,
Yes.
is not the same infrastructure that was there a few years ago. So their argument as the Patriotic Front perhaps may be that the first thing that one is supposed to do in order to be able to improve service delivery is to firstly create a conducive environment which is putting up structures which they have boasted about.
Look, we should, as much as we are talking, it's good you are talking about the issues of also infrastructure. At what cost? That's one question we should know. The amount of money the Patriotic Front have spent in the infrastructure, which they are talking about in terms of the health sector, and the amount of money Kenneth Kaunda used or spent in the infrastructure that we have seen countrywide in terms of hospitals, including UTH, you find that Kenneth Kaunda spent less amount of money as compared to today's amount the Patriotic Front has spent in the hospitals that cannot even be compared with the old hospitals that Kenneth Kaunda constructed.
Isn't that too far-fetched of history to dig into, provided that the dynamics have changed in terms of inflation, in terms of the purchasing power of the kwacha? If we go to Kenneth Kaunda's time, isn't it too much of a big margin to weigh as a scale or as a determinant?
No, no. Look, I think when we ask how much Kenneth Kaunda spent on all the infrastructure he built for the country, and we call the economists and other people to say, can you tell us what amount of money can this be equivalent as of today's rate? Then let's compare with the Patriotic Front. You find that the Patriotic Front has gone beyond what you may imagine. The money they have spent in building these few infrastructures which they have said, would have built, if it was Kaunda's time, would have built proper health facilities, unlike what we are seeing today. Imagine you are saying to say they have built this infrastructure here. They are like, for example, I'm not giving examples for some hospitals which they are doing. In Lundazi, currently, the Patriotic Front government have shifted from the old hospital to go to where? To the new hospital which they have said they have built. And what is with that hospital? It has no mortuary. Then what type of infrastructure is that? The hospitals that Kenneth Kaunda built had everything. Mortuaries and all that. Can you say also that no dynamics and all that, so meaning that the new hospitals that need to be there, they should not have having mortuaries? Unlike the old ones? The answer is no. We need to compare where we are coming from and where we are going. Are we improving? If in 1964, we can build the hospital with all the departments and all machinery, together with the issues like mortuary, then in 2021, we build the hospital without a mortuary. Are we improving or we are going backwards? We are going backwards. So I hope you are agreeing with me.
Yes.
And this is what the Patriotic Front government has done. Go to these health centers, which they are saying we have built the health center. It's what can I say? It's a building like this one. That's all. Then they get those portable petitions, tents, which they put to say, oh, here the nurse will be seeing you here. Okay, here the patient will be in case we want to observe the patient will be observed here. That's all. Who can fail to build a one-room thing? That's what the Patriotic Front have done. When you hear about, no, we have built health posts, we have built health posts. And at what price? You discover that a one-room thing, they have built it at maybe $365,000 US. You wonder, what type of people are these who can build a one-room thing at $365,000 US? So those are gymnastics that you need to put in place. Even in the time of Kenneth Kaunda, you cannot say that Kenneth Kaunda would have spent maybe $100,000 US by then to build a one-room thing. That's not true.
It's getting hot in here on the verdict, and the number that you are getting us on is 0968-675273 and 0973-167840. Please call through and make your contribution. Speaking of services, you have alluded to the fact that in as much as the Patriotic Front government has built infrastructure which you say might not be up to standard, talk about the services. How do you find the services in these rural posts, these clinics, these level 1 hospitals, and also the teaching hospitals? How are the services? I'm sure you've had an opportunity, unfortunately, to find yourself in a hospital and access some of these services.
Yeah, you see, let me start by saying this. Currently, as we are speaking currently, per every 1,000 mothers who are giving or who are pregnant or who are per every 100,000 women, 183 are dying. It is a huge number, 183. 183, what are the causes of people dying? You find that it's infections, which are treatable. But we cannot treat. Why? The hospitals have no drugs. Two, if the hospitals have drugs, they are counterfeit drugs.
We'll be getting to that a little later.
You see, when you check today, as I'm speaking, as we are speaking today, per every 100,000 lives, infants, there is 420 or die. Per every 100,000, 420. That's a huge number. And what is killing them? Infections again. Why? Because there are no medication to give.
But maybe the PF may say they have reduced that number because they found it even higher. So what would you say about that?
You cannot trust anything that comes from the PF. But look, you cannot justify the huge number that we currently have today of 183 people dying per every 100,000 women who are pregnant. That's something unacceptable. Check the investment, check the amount of money that have been put in terms of maternity activities by all the cooperating partners. You find that the money is too huge, but it's not happening. Why? Because the money that's supposed to go where it's supposed to go, it has been used in a corrupt way. Check the amount of money that is being put in terms of the for infants and child activities by other people. You find that the amount of money is too much, but what the people are expecting or receiving is something very bad. So this is what I'm trying to say. In terms of service, it's something that is something unacceptable, and the PF should be ashamed of themselves to fail for failure to provide a proper health service to the Zambian people. Let's go further. In 2019, they told us to say we are going to introduce what is called the National Health Insurance Scheme. And the purpose of that National Health Insurance Scheme was to remove the out-of-pocket money that you spend as you go to the hospital. You go to the hospital, they tell you to say, you can't do this laboratory test, go do by that private laboratory. No, you can't do this CT scan, go do this by this. You can't do this, you can't get drugs here.
Perhaps hold your thought, we have a caller. You're through to the verdict, your name and where you're calling us from. Good evening. We seem to have lost the caller. You were talking about the insurance scheme. Yeah,
so you find that the purpose was to remove that. But is it doing that? The answer is no. And it's the purpose of the insurance is to make sure that it supplements whatever the government is trying to put. But today is the NEMA doing that? The answer is no. And how many people are registered under NEMA as of today? We have more than 900,000 people are contributing to NEMA. But what is NEMA doing to your money? They are using your money to put in what is called the money market. For me, that I call gambling. What is that?
But these are trusted structures that financial experts tell us to be able to invest in.
I'm happy I've said the investment. And as you are doing the investment, you need to look into the two coins. There's a negative and a positive. What if comes on the negative side? Who's going to be accountable for that? The money you contribute, the hard-earned money that you contribute so that you find drugs in the hospitals, it is used in gambling. That's what I can say. Is that the way it's supposed to be? No, that's not the way it's supposed to be. But the Patriotic Front is doing that. When you go to the hospitals, you can't get drugs. When you go to the hospitals, you are told to go do the lab tests from other services, from private hospitals. When you go to the hospitals, you are told you can't do the CT scan because our machines are down. When you go to the cancer hospital, you are not given the medication. They tell you to say, go buy your own anti-cancer medicines. Who does that?
Speaking of medication, okay, there is a caller on the line, so I'll hold that thought and you can do the same. Good evening, you're through to the verdict.
Yes, madam.
Your name and where you're calling us from?
I'm calling from Lusaka, the Banana Center Service.
Please go ahead with your contribution.
Yes, madam. The big man, what he's saying is true about the health issues. If you go to Pika, there is a microchip at the hospital. They have opened that hospital without the mortuary. If someone dies there, that means they have to give you job while you are taking the body to Pika State Hospital. And this is so what that man is saying is true, madam.
Thank you so much for your contribution. We really appreciate. Remember that the views expressed on this program are not the views of Camnet TV, but the views of the person speaking, who happens to be UPND Health Committee member, Mr. Jerome KANYIKA. The number that you are getting us on is 096-867-5273. I pinned your thought concerning the issue to do with medicine. Are you happy as the UPND Alliance, the availability or the non-availability of medicines in our health institutions?
You see, as UPND, we are not anywhere near happy about the non-availability of drugs in the hospitals. And what pains us most, actually, what pains us most is the reckless of the PF government in giving the Zambian people, giving our parents, giving our grandmothers and fathers, our brothers and sisters in different parts of the country counterfeit drugs that are poisons. That thing, every day it pains us as the UPND Alliance. And that thing pains President Hakainde Hichilema on a daily basis, because he fails to understand what type of people are in the Patriotic Front government that can subject 17 million of the Zambian people to poisons. You see, he fails to understand. Sometimes he even says to say, so when I try to remember and think through about the counterfeit medicines that the PF government subjected the Zambian people to consume, I wake up in the middle of the night, start crying to say, how can you be this ruthless, reckless in providing the services that you are being given by the poor Zambians to provide, while you go and provide them rotten or counterfeit medicines? It's something unacceptable. And for your own information, as the new statistics are showing, the HIV rate has gone up by 26%. I think you carried that story, if I'm not mistaken.
Are you attributing this to...
I'm not attributing to Camnet.
No, not Camnet.
But I'm saying, wait,
okay.
let me go through with my, let me go through. The HIV rates have gone by 26%. You should ask yourself, why all of a sudden the HIV rate has jumped that far to 26%? You should not forget that a year ago you were provided or you are given condoms that were leaking.
That's where I was getting to say, are you attributing the two? The increase and...
What can you explain the increase? You know, the only barrier for you from not getting HIV and AIDS, it's using a condom. Now, a condom you are given were all leaking. Now, today as we are speaking, the HIV and AIDS rate have jumped 26%. Then you are asking, what is happening? What are we doing wrong? What you are doing wrong is you provided the Zambian people, the 17 million Zambians, with condoms that were leaking. And today the results have shown, even before we kick the PF out of office on Thursday, we have seen increase in the number of HIV and AIDS. On the number of STIs, I wish you can go get the statistics at the Ministry of Health. It's also something else. During the same period of using those condoms that were leaking. And when you check again, in non-communicable diseases, like the BP, the kidney failures, the liver failures, also the rate started increasing the moment the Zambian people were subjected to having or taking those counterfeit medicines. As a result, we had an increase in the number of people even requesting Leno services at UGH, which resulted in Leno consumables finishing or running out. Why? The number of people who were found with kidney problems, the number increased after consuming those medications. Can you say the PF government cares for you? Today, when the Ministry of Health announces the number of people who have died due to COVID, there is those who have said these have died because of COVID. These have died to COVID-associated deaths. Do you know what other conditions they have? These are people who have BPs, cancer, and other diseases. Do you know the causes of these other diseases, the rise in these other diseases? Because of the counterfeit medicine that this reckless government gave it to you.
Still on the issue to do with services, are you happy as the UPND Alliance, the number of staff that are in these hospitals? I've pinned that other thought because we'll still be getting to it.
Yeah, no, what you have asked is a very good question. And let me tell all the graduates, currently we have more than 30,000 health workers who are not yet employed, but they are well-trained health workers. And let me tell them, as I'm speaking now, when you go to vote on Thursday, when you vote for UPND, make sure that you go clean up your papers and prepare to apply for a job on Monday. Not the other Monday, the next coming Monday. Why have I said so? Let me start profession per profession. The patient to a doctor ratio currently in Zambia is 1 doctor to 12,000 patients. Well, WHO recommends that 1 doctor should see 2,000 patients.
We'll pin you on the ratios. We have a caller. Good evening. You're through to The Verdict on Kamna TV.
Good evening, thanks, madam.
Your name and where you're calling us from?
I'm Daisy and I'm calling you from Chinwala.
Please go ahead with your contribution.
Yes, my contribution is a commendation to that gentleman seated next to you there. Those are the type of people that we wish to have in our country. How I wish the likes of Chikan Silofia and the Kenneth Malak were like that gentleman. Zambia would go very far away, yes, in terms of our health. Yes. Because currently the hospital that the TF is boasting about to have constructed, there are literally no proper services there which should be enjoyed by our citizens. They will have a lot of qualified doctors who are just languishing in the streets. They are unable to employ them. But we have a lot of money that they are pushing just into their own fat cutters. Other than that, we have the few doctors that they are putting in the hospitals. They are able to satisfy them to pay the money that they have already wasted for, which is very unfortunate. So we wish people will do the right thing for the patients of health to be enjoyed by God and everyone. Thank you so much.
Thank you so much for your contribution. The number that you are getting us on is 0973167840 and 0968675273. I pinned your thought concerning the patient-doctor ratio.
Yeah, I was saying, currently in Zambia, the ratio is 1 doctor to 12,000 patients, but WHO recommendation is 1 doctor to 2,000 patients. So meaning that already in Zambia, we have shortages of doctors, but we have doctors who are not yet employed. Not I'm saying doctors, as you are listening to me now, when you go vote in the next 48 hours, make sure that you also get ready to go apply for your job on Monday at the Ministry of Health, and you'll be posted by next week. Coming to the nurses, who are the majority of the people who are not yet employed, including the clinical officers, the ratio of a nurse to a patient level, to a patient ratio, currently in Zambia is 7,000, 1 nurse to 7,000 patients. And WHO recommendation is 1 nurse to 1,000 patients. So already there is a shortage. Go to the other profession or to the other cadres in the profession. It is for pharmacists, I cannot even mention because it's too huge. So you already see that there is shortage of human resource in the provision of the health service when we have more than 30,000 who are not employed. And why these are not yet employed? The money has been misappropriated or has been used in corruption and other activities. These things that I'm saying, we are seeing them on our yearly or daily basis from the Auditor's General report, from other FIC report, and other reports that are happening. If we kick out the corruption, which President Hakainde Hichilema is going to kick out corruption in the Ministry of Health, who have enough resource to pay the health workers who are not yet employed. We have a lot of facilities, health centers that are running, and when you check these health centers, there are no any clinical officers. But we have more than 80,000 or 10,000 clinical officers who are not yet employed. What is that? Well, the people of Zambia, the poor citizens, require a service, and the people who are supposed to provide the service to them, who are clinical officers, are not yet employed. Today, when you get a stone and you throw in intercity market there, you find that there are high chances that it will land on a health worker who is not yet employed. Is this the way it's supposed to be? And when I go a step further, those who are employed already, you find that some have upgraded. Some, they are diploma holders, they have upgraded to degree, but they have not been moved to the right position which they are supposed to have. What is that? Someone was a master's, a PhD, but they are still getting paid as a diploma holder. Under UPND government, those will come to an end. Just that after voting on Thursday, those things need to come to an end. You check a lot of doctors who are working today, they are still getting paid as junior resident doctors. Well, they have even moved to senior resident doctors and other specialties, but they are still getting paid under the same post which they started work. What is that? When you check to nurses, when they start work, they start as general nurses. They go upgrade to midwifery. They are not upgraded to vacancies of midwifery. What is that? Can you say people who are working in the health sector are motivated? Can you say they can provide proper health care? Well, they know that this work I'm doing is not equivalent to my paper that I have. They are not, they are very much demotivated. And when you check very well, as a manager, what you need to do is to motivate your workers. But the manager we currently have in the form of Patriotic Front government, they are demotivating us, the health workers. That's something unacceptable. And President Hakainde Hichilema, as a good manager, which you have seen by the way he runs his life and his businesses, you are going to see that he is going to motivate his subordinates who are the civil servants. And in this case, the Ministry of Health civil servants.
Not too long ago, we saw doctors, the Doctors Association of Zambia actually striking. What do you make of that as the UPND Alliance?
Yes, this is which I'm trying to say here. The doctors were striking. The reason they are striking, do you know? They are striking for non-promotions. They are striking for not paying them the salary in allowance. Look, imagine you finish your school. You are posted to an institution where you need to go work for a good number of years. Then as you reach that institution, they tell you that, no, we cannot start working, we'll pay you salary in allowance whenever we have the money. Who operates like that? Then how are you going to get settled? Can you provide the proper health care service to the members of the public when every day as time for knocking off is approaching, you are thinking, where am I going to sleep? What am I going to eat? This is what they were requesting for. We have seen, you see, the doctors were bored enough and them they just spit it out. For the nurses, it's worse. For clinical officers, I don't even want to touch there because it's worse. The last time the PF government employed clinical officers, radiographers, pharmacists, biomedical scientists, it is maybe about 5 years ago. Which government stays like that? Well, we are fighting a serious pandemic in the name of COVID. Have you seen that the PF government have no priorities? We are fighting a global pandemic where other countries, even the retired health workers, are being called because of shortages of health workers. Here in Zambia, we have more than 30,000 health workers who are supposed to see the patients. Then again, we are start asking to say, no, the number of people are dying are going up. No, we are failing to fight the pandemic properly. But you are forgetting about the fundamentals. And the fundamentals, the main fundamental of everything is human resource that you are not providing for. President Hakainde Hichilema, in the last briefing which he had, he mentioned to say, in the fight for this COVID, in the fight and help the health workers to motivate them as a good manager, is going to make sure that he's going to suspend the pay as you earn for health workers for the next 6 months, which is better than debt swap. So if I'm still working as a health worker in government, definitely my vote is none. I need to vote for Hakainde Hichilema and see what am I going to have or get as a full salary without pay as you earn, as a motivation for you to go an extra mile to serve the Zambian people.
Pin your thought right there. We have a caller on the line. Good evening. You're through to the verdict on Kamna TV. Your name and where you're calling us from. Hello? Hello? Your name and where you're calling us from. Good evening. Thank you. Your name and where you're calling us from.
I'm calling from Soweto.
Please go ahead with your contribution.
Okay, the contribution is this. I'm very much disappointed with the PF government. They introduced this health insurance policy where they have been paying, but we don't know where to get the money. In hospital, there are no medicines, there are no machines, and even what nurses have not been paid their house, and doctors as well. So we cannot condone that as a nation. So we need a care in the government. And so that's why we have decided to come Thursday, we are changing the government. Thank you so much.
Thank you so much for your contribution. We really appreciate. The number that you are calling us on is 0968 675273 097316716784. As you were saying.
Yeah, I've even lost my thought.
You've lost your thought. Perhaps still on issues to do with doctors striking.
Yes. Okay, okay. I was mentioning to say doctors, they had to stand bold enough and they had to strike because it was too much for them. Where someone is working for 36 hours. Do you know what it means working 36 hours? Without resting, you are still working. And you are not a computer, for God's sake. You are using the brain cells that uses oxygen. And now you are made to work 36 hours straight. Well, there are other doctors who are not yet employed. When Dr. Sampa stood and said, no, this is unacceptable, he was fired. What type of government that does that? When you go, I feel for the nurses. They are working some from 6 hours to 18 hours. Well, they are supposed to work from 7 hours to 13 hours. Another person comes into a shift from 13 hours or 12 hours to 18 hours. Another one comes to finish up the night just like that. But you find that one nurse working from that time to that. And they are seeing a population of more than 10,000 people as one individual. That's something unacceptable. They get tired. When they make mistake, they write wrong medications. When they write wrong conditions, you start insulting them. No, don't insult innocent health workers. Insult the government that is failing to provide a conducive environment for the health workers to flourish properly and the way they are supposed to function as humans, not as machines.
Still on issues to do with service provision, I had mentioned that I pinned your thought concerning issues surrounding medicines. Are you, as an alliance, the UPND alliance, that is happy in the manner that medicines are procured? Do you think that there are enough measures to ensure that the procurement of medicine is, one, safe? Number two, is within budget? What's your take on that?
Look, the procurement for the Ministry of Health is such rotten, full of cadres. That's the unfortunate part. And it is full of the PF officials trying to influence the procurement of these commodities. We have a lot of companies that are of PF cadres who are supplying drugs to government hospitals, who are supplying medical equipment to government hospitals, which they don't even understand well. How can you give me the contract, me who knows nothing about the studios and all that, to supply the studio machinery? I'm a pharmacist. Tell me about supplying the drugs. I will be able to supply quality and efficacious medicine to the institution. But with the PF government, the answer is no. And when you check very well, the contracts that are given are all exaggerated in terms of pricing. Do you know that in the NEMA, which is under the PF government now, 10 tablets of salbutamol tablets, Ventorin, the PF government gets 2,000 kwacha? Well, when you go in a private pharmacy, it's about 5 kwacha. When you check other, which when ordering of medications, when you are bidding, or when they are putting the prices for drugs in the PF government, a bottle of Piriton, which is about 1,000 tablets, you find that they put the price of that maybe about 500 kwacha. Well, when you go in a private pharmaceutical outlet, the bottle of 1,000 tablets of Piriton is about 30 kwacha. Have you seen how they do? And they are getting the money that they are not supposed to get. This is being unpatriotic to the country where you are born and your own country, which you know very well. Unless we say that the people are providing this are foreigners. But unfortunately, they are surrogates of the PF party. So we have these challenges that is there. And as UPND government, we are saying we are going to introduce a transparent way of procuring of commodities in terms of the drugs. We are going to reduce the freight costs, and we are going to encourage a local manufacturing of medication.
I'll pin your thought right there. We have a caller. Good evening. Your name and where you're calling us from.
Hello.
Hello, good evening. Your name and where you're calling us from.
Yes, good evening, Madam. How are you?
I'm well, thank you.
Thank you. I'm listening to the debate on just KANYIKA. Yeah, that was going to be concerning the NEMA. Yes, that thing is very pathetic. Because if the patient goes to hospital, there's no system there. Okay? Because that's the thing I was supposed to be dedicated at least one of the insurance companies. Because insurance companies, they are able to manage health care than in the government. Because the insurance company will make sure that where you go, there is medicine. And like in the NEMA, which is under the government. So I just want to thank the KANYIKA for the explanation. Come and say we are taking HEATH and the UPND board. For health, that one is what you are saying is correct. Very correct.
Thank you so much for your contribution. We really appreciate.
You see, what I'm saying is not that because I'm UPND. When even President Hakainde Hichilema with his people is going to choose in his government to work, when they start doing what the PF are doing, I'll come here and say, Ababantu Baluba, they are doing the wrong things. You see, it's something, these are matters that all of us as Zambians, we need to stand up and speak against. We should not be sounding like we are in a cult, where even if someone has done wrong, we need to defend. No. These are things of life and death, and the health sector should not anywhere be touched by anyone. You see, let me also take this chance to challenge the Patriotic Front government to publish the Global Fund auditor's report about the Ministry of Health and how they have abused the money for Global Fund. Let them publicize that. You have not covered There is no any station that have covered that.
Perhaps you may avail us that information so that
No,
we are
let
also
let
abreast.
them do that before they start saying we have gone whatever way which we are not supposed to go. But let them publicize that documentation, because the services that are provided are for you, the people. But you are going to see how they have used the money for donors into political activities. That's unacceptable. And President Hakainde Hichilema cannot allow anyone to do that. That's the kind of a leader Zambia needs. Let the PF government, through the Ministry of Health, publicize or refuse the abuse of global funds, and let them show us the audited reports for global funds, and let them say that the money was not found used in the PF activities. Let them publicize that. Then you see how reckless the Patriotic Front government is. And here they are playing with donors' money. Who does that? As we are speaking today, most of the activities under the Ministry of Health that are donor funded, they have reduced. The donors have reduced funding.
Isn't it maybe because of the global pandemic?
No, it's not about global pandemic. It is because of misappropriation, corruption, and abuse. If we kick out these things, we are going to see that even the donors, they are going to give us more funding for the activities that we need.
Maybe they also need the money because they are also fighting a pandemic, hence the reduction in the money that they are giving to countries like Zambia.
So you mean the United States government, they don't need the vaccines?
They do need the vaccines.
But they gave you the vaccine, 300,000 doses.
Perhaps what you are saying is that
I want to
maybe they should have given us more vaccines, but they haven't.
No, that's not what I'm saying. You see, that's not what I'm saying. They have also given us about 530,000 doses of Pfizer vaccine. Again, themselves they need.
Mentioned
but
the fact
you
that
mentioned, but I said they have reduced the funding to
so
some of the activities
because
of corruption, because of the funds.
Let me
not
pin
used.
your thought
Okay.
right there.
Thank you.
Your name and where you're calling us from. The network seems to be bad. Hello? Please move where you are and call us back. We were saying that you had mentioned, just a minute.
Yes.
You had mentioned to say donors have reduced the amount of money that they are giving to Zambia as a result
why?
of
Because of corruption in the Ministry of Health.
So now I'm just thinking to say perhaps the reason why we have a caller, I'll continue with that thought. You're through to the verdict. Your name and where you're calling us from.
My name is Paul from Sada.
Please go ahead with your contribution, sir.
Yes, the program is good. I just needed some more as the gentleman has done, or where I worked for. If he's worked in government before, or Minister of Health, because certain things that he's talking, I think it's not for us, what is happening in the government. One, the work system of the nurses that was wrong, the way that we look at it. That's just the same. Second thing that I don't believe it knows how the system works in the government. It's not just talking, you just talk because you want people to get from there. You should come with documents which you have started. We have done research to help people understand how the system is working. So my brother is working to some, especially the way I explained there. It sounds very nice, but it's not what is on the ground. Because nurses work after. They are not working in the government. If anything that does not work, but I've worked in the hospital. So, point that I want my brother to explain it, but that you know better than just I'm just saying what I don't belong to any party. So what he's saying is wrong. How do I vote?
Perhaps let's give him an opportunity to be able to respond to your concerns. Mr. Kanyika, he asked a few questions.
It is something very laughable, I can say. I'm very surprised we have such kind of people can think like that. But let me say the truth here. The fact is, nurses we have a lot of nurses who have upgraded from diploma orders to midwifery to degree orders who have no vacancies and are still serving as diploma orders, which they are not supposed to do. We have a lot of nurses who are not yet employed while they are finished school. These are facts. We have a lot of nurses working double shifts where they are not supposed to be working double shift. These are facts. So what is he trying to say? You see, he should understand very well that working in the government, you should have a prudent manager who should motivate you. Currently, we don't have a prudent manager. Provided we have a prudent manager, all the health workers will be motivated and they'll be working very well. Currently, the Patriotic Front government is not doing that. How can you go to school, you upgrade using your own money, then you are not being promoted? So does he understand what he's talking about? The answer is no. But what I can ask from my brother, since he said it's not decided, my brother, for the sake of your children, for the sake of your relatives, vote for President Hakainde Hichilema. And make sure that you put your vote on him and you are going to see the results starting on Monday as he takes over. So for all people are doubting like my brother there, let them go to the hospital or some facilities somewhere. They find that this time as we are here, some facilities are closed. People are not working there. Why people are not working in that facility? Because we have shortage of human resource. As a result, the facility cannot operate 24-hour service. Do you, if I ask my brother there, do diseases or sickness decide what time we are going to have the sickness? Does it say you are going to only get sick from 8 hours to 17 hours? You get sick in the midnight, in the midnight, and all the facilities that are near you are closed. When you call for an ambulance that you are supposed to be provided for under NEMA and under the mainstream of government, it is not also there. You end up dying in your own house because there is no means of you being transported to the health facility that is operating 24/7. And when you go in that facility that is working 24/7 around midnight, you find maybe 3 or 4 nurses are seeing the entire hospital, which has more than 300 patients. What time are they going to see you who have come with an emergency? These are the facts. These are the things that are happening. And these are the things that pains me. These are the things, not only me, these are the things that pains President Hakainde Hichilema. This pains him very much to say, look, my Zambian citizen, they are supposed to get the best healthcare services. But look what is happening here. You go to this health center, you find that it is closed at 17 hours, and now the citizens who live here, who are more than 3,000, they cannot have any access to a nearby health facility.
Do you have any cases in point where you know that that is actually happening? I know in Lusaka, that might not be heard of, but do you have
Zambia is not Lusaka.
Yes, that's what I'm getting to say.
Yes.
Perhaps you have some places in these rural areas that you can point at to say that is the prevailing situation.
You see, go to just a nearby place here. Go to the facilities or health centers just by Chilanga district there. Just near here, Chilanga. Ask the, not Chilanga clinic, but they just health post, none of you. You find that 17 hours is closed. Go to Kafue, it's the same. Go to Chongwe, just Chongwe here. It is the same. These are the facts that are happening everywhere. And these places are not far from Lusaka. Now imagine in Kaputa, which even have no any proper health facility or health centers. 17 hours they are closed. Are you seeing the suffering that is in the Zambian people? These suffering are being provided for by the recklessness of the current government, the current regime. If they see the need of these hospitals to be working or facilities to be working 24/7, they would have employed the more than 30,000 health workers who are in the streets. If today health workers are not in the streets, we would have said, no, we need to train more health workers. But we have trained. Now they can't find jobs.
Let's move a little bit forward in our discussion. Issues to do with evacuation, where perhaps I have kidney failure, I have a heart condition, a brain tumor. Most of the time, our teaching hospitals are unable to provide for such procedures, and every now and often patients are told to be evacuated to either South Africa, India. These are the common countries that most people go to for health care provision. What do you make of such a situation, and what do you intend on doing if you come into power to change the status quo?
You see, in our field, the medical field, whether you are a doctor in India, you are a doctor in South Africa, you are a pharmacist in UK or a pharmacist in Zambia, we all learn the basic things. We have like a universal curriculum, which we do and learn in terms of things. If you specialize, we do the same. What do Zambia health workers lack? It's equipment. And this is what the UPND government is going to address. We started a long time ago. We had people like Professor Lambert, who participated in the separation of the banders. They went to do the separation in South Africa. What I'm trying to tell you is, this is a Zambian with the knowledge and everything, who went to do an operation for the Zambian citizens in South Africa. Why did they travel to South Africa? And when was that? That was a long time ago. It indicates to you that there is lack of machinery. And this is what the UPND government is going to address. When we provide quality health workers, giving them the quality equipment, we are going to see that even the people will be evacuating to other countries, it will come to zero. Because we have everything. We have a situation where our machinery, especially the people who are suffering much, are the cancer patients. There it is now just like, it's just a building. Nothing is there. All the machinery is not working. Now every small thing that's supposed to be done, go to India, go to other countries. Who does that? And as the UPND government, we are going to make sure that we repair all the machinery and procure new equipment for our health workers, for them to be providing quality health care to the Zambian people. I know people are going to say, oh, and all that. Let's kick out corruption. Just from corruption there, we are going to save a lot of money that we are going to invest in the health sector. Besides that, you yourself, when you check your payslip, you find there is NIMA, the money which you are contributing. Where is it used, the money? We are going to stop an institution like NIMA to start putting money in gambling. That's money market. We are going to stop them because they need to concentrate in providing a service to the Zambian people. Not in terms of issues of, no, let's invest the money. Why should you invest the money? Well, the people who are supposed to receive, who are contributors to that money, are not receiving a service. First, the people receive the service. Then that's when you can talk of investing. Okay, how can you yourself, you say...
We'll pin your thought on NIMA. Your name and where you're calling us from?
Yes, this is recording from Lusaka.
Please go ahead with your contribution.
Yes, madam. What he's saying is the truth. Nowadays, to get a job in the Ministry of Health is something very difficult. I remember last week, there were some nurses who even went at the Ministry of Health and they was protesting for a job. But what they said, when they went that side, they were told, no, there's nothing like that. And this time around, there are lots of nurses and other health professionals that are not unemployed. Because it's very difficult to obtain a job in this patriotic front regime. money just to get a job that is just sitting at home. Some have been started selling charcoal, vegetables, which is not okay. They have been forgetting what they were even learning at school, which is not okay. But what I can just appeal to my friends out there who are not professionals, let's all together vote for HH so that we can get a job. Because I was so hard the time when HH said no, the time when I come into power, I'm paying your focus, which is okay. But because this time around, it's very difficult to get a job. That's what I want to contribute.
Thank you so much for your contribution. Remember that the views expressed on this program are not of Camnet TV, but are of the viewers themselves, the ones that have called in, and our guest, who is the UPND Health Committee member, Mr. Jerome KANYIKA. We are actually in the dying minutes of the program. I know we've tackled a number of issues, and I know due to time constraints, if that were not the case, we would have gone on and on and on. But lastly, I know it wouldn't be in order if we don't tackle this issue. Issues to do with COVID. Do you think the PF government has handled the COVID-19 pandemic exceptionally?
No.
Considering that now we have seen a reduction of the cases?
No, they have not done well in the fight against COVID. Let's see. You see, we should see the reasons why the cases have reduced. You should know very well that in the Zambian pattern, when it starts getting cold, the cases are going up. And this is the time when it's rain season and when it's cold season. And when it's getting hot, the cases start to reduce. This is our pattern, what we have seen from last year to this year.
But someone might argue that the fifth wave is actually coming in October.
Wait, let me explain. The fourth wave, which you are saying it may come in October, we don't know what is coming in the future. But I can assure you, by then when it comes in October, President Hakainde will be in State House, and you will be able to fight coronavirus the way we are supposed to fight. You see? So, in terms of the PF, what they have done in terms of COVID, I think they have not done the correct thing. For example, we heard of people, the Ministry of Health misappropriating 1.5 billion worth of money that's supposed to be used in COVID fund. That's supposed to be used for COVID purpose. Can you say they are serious in fighting the virus? The answer is no. When you check very well, what those people who died, most of the people who died, me I lost my very close colleague, very close friend. Why I lost a friend of mine? Because the hospital didn't have oxygen. Sure, in this 21st century, with where we have not heard of any company that produces oxygen saying that they are failing to produce oxygen, a person dies in the hospital because of lack of oxygen? No. That's something unacceptable. That shows you that the PF government has not done anything exception about solving the problem with COVID. Instead, they use the issue of COVID to bring in terms of politics. And when you are fighting issues like a serious pandemic like COVID, you make sure that you kick away politics and do the correct thing. But the PF have been failing because to them they believe in politicking than working, which the UPND government will not do. Check in terms of how the testing have been done. As of now, the testing which they are doing on a daily basis, the maximum should be about 6,000 tests. From what number they were doing the tests? From the number of 10,000 or some they reach up to 15,000. But we are saying, no, from 6,000, how can you know the actual number of people you have for COVID? Test 100,000 and let's see the number of cases we have for COVID. Then we are going to say, yes, the numbers are reducing. But you test 200 people. Then you say we have only found 2 people who are positive. No, let's clap for ourselves. We have fought the COVID-19. That's something unacceptable. Do mass testing. Then see the number of people whom you are going to find positive. Then come and communicate to us. Then we are going to clap to say, no, mwabombeni. But as currently, from just for 6,000 tests, then you tell me I should clap for them to say you have fought the coronavirus. No. Well, they have misappropriated about 1.5 billion kwacha that is supposed to be used for COVID without anyone losing a job. Are we serious in fighting issues of corruption in the Ministry of Health? The answer is a big no. So this is a very reckless government that's supposed to be kicked out in the next 48 hours and have a prudent, well-coordinated and corrupt-free government of President Hakainde Hichilema.
Your closing remarks.
My closing remarks to the people is let's make sure that we go early to vote and let's remain calm as we vote. Those who have energy, they can go back later in the afternoon and go witness the counting of the voting. And make sure that as you go to vote, please wear your mask, observe physical distance, and observe all other COVID measures, because we want you to celebrate with us as President Hakainde Hichilema wins these elections, which will happen on Thursday. Thank you very much.
Thank you so much for making time to be with us, Mr. Kanyika, on The Verdict. This has been The Verdict right here on Camera TV, not just another channel. I have been your host, Liseli Kanyanga Mubanga. Please stay tuned for the main news at 19:30 hours. Good evening.